We're going to talk about the patellar dislocation. This is the patella and it connects to the quadriceps tendons and the patella tendon. There are 3 types of grade stages. The first one is mild and the ligament is slightly stretched, but you're still able to keep your knee stable. The second stage is your ligament becomes loose and it was referred to a partial tear of the ligament, and this rarely occurs. The final grade is the most common and is complete tear of the medial patellofemoral ligament, and the ligament splits into 2 pieces, and this makes the knee unstable. Next, I'm going to talk about 3 different types of dislocations. The first one is habitual dislocation of the patella, and this occurs every time the knee is flexed, but this is a painless displacement. The second is recurrent, and this is isolated episodes. This is response to trauma, and this is followed by pain and swelling. The last one is comical dislocation, which is present at birth and is associated with the lateral position of the entire quadricep mechanism. The last thing I'm going to talk about are the different types of stages in recovery when it comes to patellar dislocation. The first one is the revolution of getting rid of pain, swelling, and inflammation of your knee. The second is recovery of joint motion and flexibility. The next is muscle strength. The next is recovery of motor patterns and coordination. And lastly, the recovery of returning to sports activity.
With the patellar dislocation, the most affected populations are young, active, adolescent individuals. The athletes are at higher risk. The patella dislocation stats say in June 3rd, 2019, about 5.8 per 100,000 people are affected, but it can also go as high as 29 per 100,000 people in adolescent population specifically each year. Acute dislocations occur relatively equal to males and females, roughly around the age of 10 to 17 years old. Hi, joining us today is an internet sensation, Susie Rocket. So how old are you?
I'm 14.
Is this your first time dislocating your patella?
Yes, it is.
So how did you dislocate your patella?
So I was playing basketball with my friends, and I went to jump up and grab the ball, and I landed on my knee, and it went inward and I felt a pop, and then afterwards I wasn't able to straighten my leg.
So what signs and symptoms did you notice when you heard it?
It was very painful, it was very tender, and it was really swollen, and my knee looked like really weird and deformed. I couldn't move my kneecap. I could move my kneecap from left to right.
Oof. Are you in physical therapy right now?
Yes, so it's been 4 weeks since my injury, and I'm finishing physical therapy this week.
So how long do you think your recovery is going to take?
I can't go back to my sport until next week, so my full recovery time is about 6 weeks.
Oh, so did you need surgery for your injury?
I did not, because it was my first time dislocating it, so I didn't need surgery. I wore a brace, and then I used crutches for a couple of weeks.
Good. Well, I'm glad you're making a fast recovery. Thank you for being with us today, Susie.
Thank you.